And you could put that in presenter mode if you want to, Michael.
Yeah, thank you.
There we go. All right, now come on, some people get on, please, so that I can know it's working.
It says 4 so far, so a couple people must
Oh,
already.
great. There we go. Everyone. Let's see here. Aha. Attendees. There we go. I see Debbie and Pam and Thomas. So we'll wait. And now we've got Brittany. Excellente. Welcome, everyone. We're going to get started here in just a minute. I'm going to give it a couple of minutes. I just, if everyone, if you're having any trouble hearing me, just please put something in the chat so I can be aware of it. Otherwise, I'm going to assume everybody's hearing me.
Hey, Cindy.
Yep.
During the time when I'm doing the talking, I don't check the chat very regularly. But
I'll
if
be
you
doing that.
okay, and if you see a question, feel free to interrupt me and ask, because I'd rather, if I can, I'd rather answer it on the spot and engage.
I'll do that.
All right. So that goes to everyone listening. If you have any questions during the presentation, I don't mind you asking them. And if I think they're going to take a longer time, I might hold that question until the end, but I'll do my best to answer it on the spot or hear your thoughts.
Yeah. And we're going to wait a couple more minutes because I want to be sure that we give all the people who registered time to get on. We'll get started in just a minute, everybody. Okay. I'm going to wait till one more 50 seconds and then we're going to get started. Because I do want to be mindful of everybody's time. We're almost there. All right, well, I'm going to go ahead and get us started. And my name is Cindy Snyder. I am with the Georgia Center for Oncology Research and Education. My role is the administrator and coordinator of the Cancer Patient Navigators of Georgia group, which is a statewide organization for cancer navigators. This is the first of our quarterly webinars for CPNG, Cancer Patient Navigators of Georgia. And we are so fortunate to be able to partner with the Georgia Alcohol Policy Alliance for this presentation. Michael Mumper, who is the president of the Georgia Alcohol Policy Alliance and the executive director of Georgians for Responsible Marijuana Policy, is our presenter today. And I'm going to, in just a minute, let Michael take over, but a little bit of housekeeping. This presentation has been approved by GNA for contact hours. So for people who need contact hours, once the presentation is done, the survey for that will come up in your browser. Once you complete the survey, then the certificate will be there. So you'll just have to make you'll have to save that image and make sure you save the certificate. If you have trouble with that, I'm going to put my email in the chat so that you can have that in case there's any difficulty. The other thing is I put in the chat, and again, I'm hoping everybody can hear me. Please, if somebody can just put in the chat, we hear you, that would be great, because I just want to be sure. But if y'all can put in the chat, like your role, if you're a nurse navigator, a patient navigator, a survivor, a caregiver, if you can just, you don't have to put your name, just the role, that'd be great for me. Okay. So if I can, okay, somebody is raising their hand. Thomas, I'm going to allow you to talk, Thomas.
Yeah, I was just gonna say I can't put anything into the chat.
You can't. Okay.
No.
All right. Well, that's a shame. I need to fix that if I can. I'll work on that.
Thanks.
What about Q&A? Can you put anything in Q&A?
No open questions. Oh, I see
Yeah.
that, Thomas.
Q&A
It did
works.
okay, great.
Cool.
So yeah, okay, put it in the Q&A if you can. Put your role in the Q&A. Like I said, just, you know, patient navigator, cancer navigator, caregiver, survivor. There you go. Thank you. Consumer advocate. Wonderful. Okay. Okay, this is working. It's so wonderful. Okay. All right, so we're going to let Michael get started. And if you have a question, put it in the Q&A and I'll be glad to stop Michael, or we may save it till the end depending on the question. So take it away, Michael.
Cindy, thanks so much. And thanks to the Georgia Center for Oncology Research and Education for giving me the opportunity to speak today. Just for qualification, I am not a cancer knowledge expert. I'm a substance abuse prevention practitioner and policy person. So I'm used to reading other people's research and experience implementing solutions and then putting them into practice in our communities and in our state. Now, this issue, every issue that I deal with is a brand new one for me largely. So this issue was just brought to my attention in the last 4 months, and I've tried to be a student of it. And but I don't speak as a PhD in this topic. I think I've so today's talking today gives me the opportunity to put down on paper what I've learned, because I'm having this conversation with organizational allies across the state of Georgia right now. I'm having this conversation with state legislators right now, and it's important that we are smart about it. And so I welcome your questions, your comments, because I'm going to learn through this process. And plus, it'll keep both of us awake, because I know I'm not the kind of guy who likes to sit and get for an hour. So if you'd like to engage, I asked Cindy if she'd follow the chat and the Q&A. because I'm not very good at talking and watching the Q&A, but I totally give Cindy permission to interrupt me or hit at the right breaks and say, hey, we got a question in the Q&A. So I welcome that. And if it gets elongated, I might save it for the end, but otherwise I like to engage you on the spot. Thank you so much for being here today. With that, I live in Fayette County, Georgia. I've been in Georgia, the state, for 23 years now. I work for the Georgia Alcohol Policy Alliance, Georgians for Responsible Marijuana Policy, Drug Free Fayette, American Heart Association, and Georgia Public Health Association. So I do focus on public health, substance abuse prevention, and policy, generally related to alcohol, marijuana, tobacco, and prescription drugs. When we do, and when me and my colleagues learn of good strategies or interventions to address a particular public health issue, we use a suite of tools to implement them within the community and the state, providing information, enhancing people's skills, changing physical design, providing support, and modifying and changing policies, for example. Now, why should we raise awareness of alcohol as a cancer risk? First of all, there's a significant public health burden because of alcohol attributable cancers. And I'm going to dive a little deep into that so that we all get a perspective on this is not just another thing that causes cancer. It's something very real and very high on the list of things we can and should pay attention to and can address. Secondly, there's currently low consumer awareness of this risk that alcohol poses to cancer. And thirdly, by addressing it, which we can do effectively, we can also raise awareness that can help reduce other alcohol-related harms, so it can have a very magnifying impact. Now, Georgia Alcohol Policy Alliance focuses on excessive drinking, period. So it's not just the relationship to cancer. It's not just about DUIs or underage drinking or alcohol dependency. It has to do with excessive drinking, and something like 1 in 7 people drink excessively. And I'll show you what the measure of that is in a future slide. But because of excessive drinking, it kills more than 140,000 people a year, and more than 3,900 Georgians. And this is on par with, or even greater than, the number that are losing their lives to overdoses right now. So alcohol is on a high magnitude. And it shortens the life of those who die by an average of 29 years. And this is according to extensive peer-reviewed CDC research as well. The cost to Georgia is almost $7 billion. And I'll break that down for you on the next slide. That's $6.9 billion, largely is lost workplace productivity. Could be absenteeism, hangover, just not being productive at work, losing their jobs and being out of work, etc. And then there are substantial monies associated with healthcare expenses, criminal justice, and motor vehicle crashes. What is excessive drinking? By this definition, it's binge drinking, or the number of drinks per week, or whether someone is pregnant or under 21. Any of those are considered too much. So binge drinking means 5 or more drinks at a time for a man, 4 or more drinks for a woman, 15 or more drinks in a week for a man, 8 drinks or more for a woman, or pregnant or underage. Now, we're going to demonstrate that alcohol can have an impact on cancer with even much less alcohol than that. So I just wanted to make sure you knew what Georgia Alcohol Policy Alliance's typical approach is, framework. And importantly, it's not just about the alcoholic. And I'm a former alcoholic. I'm 29 years sober now, but alcoholics are not the problem with excess alcohol. In fact, they only represent 10% of excessive drinkers. It's just that we do as a society drink more than we probably realize. There are many impacts, the acute ones, injuries and violence, but then also the chronic ones, high blood pressure, cancer, reproductive health, alcohol dependence, and learning and memory, etc. Cancer is the second leading cause of death in Georgia, probably something you all already know, just behind heart disease. By the way, all these things are cited. I've got 26 or so citations on the back of this end of this presentation. You'll be able to see where we get this data from. So I'm not an oncologist or researcher, but I've read several papers, including the World Health Organization and the American Society, American ASCO. Here it is. A statement of the American Society of Clinical Oncology. And so ACSO didn't just do a study. They didn't just do a meta study of other studies. They published a statement that represents their 45,000 members that, based on all the evidence, alcohol is a carcinogen, and in fact, a group 1 carcinogen, which puts it at the top of the list of things. And I'll show you what that means in a moment. So here, the IARC, International Agency for Research, has 4 different groups of carcinogens. Number 1 is the most impactful in a negative way. And it includes things that are proven to be carcinogenic to humans. It does include smoking, exposure to solar radiation, alcoholic beverages, and processed meats. Group 2A has things that are probably carcinogenic to humans, like high temperature frying, steroids, exposure to working in hairdressing, and red meat. 2B is possibly carcinogenic to humans. 3 is it's probably carcinogenic, but not classifiable. And 4 is probably not carcinogenic. But notice, importantly, that alcohol was in group 1. Not only is it in the top tier category, but is the 3rd leading preventable cause of cancer. So non-melanoma skin cancers aside, the number 1, without much surprise, would be cigarette smoking, which is about 19% of all cancer cases. Excess body weight is 2nd, and alcohol intake is 3rd. So I had a legislator ask me last month, bacon might cause cancer. Why can't we just, where do we draw the line about things that we're worried about causing cancer? And this slide right here might help with that answer, why at least we have alcohol on the list, or why it should be on the list. 3rd highest preventable cause of cancer. And further, strong evidence links as little as 1 drink a day to increased risk for breast, head, and neck cancer and esophageal cancers. 2 drinks a day for increased colorectal cancer. Now, 1 drink, it's important sometimes to know what 1 drink looks like. This slide over on the right shows you that 1 typical beer or part of a beer of high ABV, alcohol by volume alcohol, 5 ounces of wine or 1.5 ounces of liquor would be 1 drink per day. So according to the study that the research that the American Society of Clinical Oncology put together, they included a chart that looks almost exactly like this in their study. And I know this looks a little complicated, but it does break down the difference between a light drinker, moderate drinker, and a heavy drinker. And I'm 99% sure what that means is less than a drink per day is called a light drinker. 1 to 2 per day is moderate, and greater than 2 would be a heavy drinker. Now, what's important here is that even light drinking increases the likelihood of developing cancer. The biggest number here is esophageal, 1.26. That means even one drink a day, less than one drink a day, can increase one's risk for esophageal cancers by 26%.
Right.
Female breast cancer, 4%. Now, 4% might not be a huge number, but it is statistically significant, and it does increase one's chance for breast cancer. And then moderate drinking, you can see breast cancer would increase one's likelihood of developing female breast cancer of 23%, where esophageal cancer for a moderate drinker would more than double. One would be more than twice as likely to develop cancer. When we get to heavy drinking, more than 2 a day, it can have these kind of impacts where one is 5 times more likely to develop a mouth cancer if one is a heavy drinker. And the CDC has a system called RD, alcohol attributable related disease indicators. And it measures of the people who die, what % are attributable to alcohol. And in the state of Georgia, they really get in the minutia about this, that 333 people a year die in Georgia from alcohol attributable diseases because of excess drinking. But when we expand it to any kind of level of drinking, it actually goes up over 500. And these are the number of people who lose their lives to alcohol attributable cancer. The number of people who develop a case is more than 2,100 per year. I'm just going to take a second to let that sink in and just check the chat. Okay, just no questions yet, but if anyone has any questions or comments or observations, I welcome that.
Michael, this is Cindy. I have let's just say a question. So,
Yeah.
We've gone down this road before of red wine being good for you, red wine not being good for you, or, depending on how much red wine you drink. But in all the stuff you were reading, did you see anything that indicated any level of benefit to, let's just say, a specific alcohol like red wine or something like that, for anything like that?
Yep, a couple things. Now, I'm not an expert at talking to this point, but here's a few
Sure.
things. One is that there are limited studies that demonstrate that it can have, red wine, for example, can have beneficial impacts. They are individual studies, and every single article I read said the body of evidence does not support that drinking any level of alcohol improves one's health overall.
Great.
Now, there are limited cases where it might help individual people, largely from a cardiovascular standpoint, but the body of evidence doesn't support that statement.
Okay, great. Thanks.
Yeah. Thank you for the question, Cindy. That's an important one. So that's the impact in preventing, or the inverse, causing cancer. What about for someone who already has cancer and is in treatment? Now, compared with the evidence about alcohol and cancer links and at the risk of developing cancer, and again, that evidence is pretty clear. The World Health Organization, the American Society for Clinical Oncology, just about every major medical organization would agree that alcohol is carcinogenic. Its impact on treatment of cancer, we're still in the nascent stages of that. The article, the ASCO, this Society of Clinical Oncology article that I'm referring to repeatedly, does talk about some isolated studies that show that among survivors of upper aerodigestive tract cancer, continued use after diagnosis, continued use of alcohol after diagnosis of cancer is associated with a 3-fold increased risk of secondary tumors. Now, breast cancer studies are mixed. They has no impact or it increases your chances, but they're mixed. But certain kinds, such as estrogen receptor positive breast cancer, have incurred a much higher risk of asynchronous contralateral breast cancer when those in cancer treatment are consuming 7 or more drinks per week. And then heavy alcohol use. Now, that was only 7 a week, 1 a day. Heavy alcohol use and abuse, there is rather strong evidence here that it contributes to longer cancer-related hospitalizations, increased surgical procedures, prolonged recovery, higher healthcare costs, comorbidities, and higher mortality. So definitely, if one is diagnosed with cancer, continuing heavy alcohol use is probably not in their best interest. Now, how many people know about this? According to studies that I've read, it's less than half. 2 different studies, both are under 50%, know in Georgia that cancer can result from drinking too much alcohol, according to, in this case, a National Institute of Health survey. By comparison, it's 89% for tobacco. So that cat's out of the bag pretty well. But with alcohol, there's a huge opportunity we have. And this is why I'm here at the table today. Because from a policy standpoint, we have a big opportunity to save lives by educating people about this risk that we just went over for the last few minutes. Survey research further indicates that awareness of alcohol use and cancer risk is even low among medical professionals. Now, awareness of alcohol as a cancer risk factor is significantly higher in California, which is the only state that currently requires point-of-service alcohol cancer warning. And that is the solution we're going to recommend here for the state of Georgia here toward the end of this presentation. So we pay attention to what has worked in other states. Now, when we think about what should we do about this to raise awareness, the obvious #1 solution would be to put it on a label that every single bottle of alcohol would have. There is a label that goes on every bottle of alcohol that's manufactured in the United States today. And it's this warning right here that the Surgeon General warns that women should not drink alcoholic beverages during pregnancy because of risks of birth defects. And 2, that consumption of alcoholic beverages impairs your ability to drive a car, operate machinery, and may cause health problems. As one of my colleagues says, that statement is so abstract that it's almost a disservice to people to say may cause health problems without being more specific about that. So we do want to be more specific about that. Now, the problem is that this is a federal law. Federal laws are a lot harder to change. So this warning has been in existence since 1988, and there's resistance to it being updated, even though there's a provision in that law that when science demonstrates the need, the US will reevaluate that warning, and they just haven't done it yet. Cindy, I just saw it post questions in the Q&A. Thank you for that reminder. So if we can't do it, so we are fighting this at the federal level. And I did have a conversation with my federal senator last week about this. But while we fight that battle, we're going to try to do what we can at the state level. States are easier to pass laws in than federal government. Now, before I get there, though, option 2 might be a mass media campaign. And, you know, there are things like the CDC put out this, the less alcohol you drink, the lower your risk of cancer. And that could be made into a billboard here, but we'd be competing with the alcohol industry. And if my research shows I did this research correctly, The alcohol industry in the United States spent about $7 billion last year on marketing alone. And there's no way we in the public health field could compete with that. And even if we could, for 1 year, it was not a sustainable strategy. So mass media education is not the way to go, which leads us to option 3, which would be point of service signage. So if you walk into a liquor store or a bar and restaurant today, you'll see this sign in the state of Georgia. Some of you may recognize it. Every alcohol retailer is required to have it. It's just a sign in the store. It is done at the state level. What we're proposing is that we replace it with this sign that's going to retain the pregnancy message. It's going to add color and visuals and a readable font to draw more eyes to the sign, and then add the important cancer message. I did talk to my friends in the maternal health field because I wanted to make them know that, I wanted to let them know we're not trying to overtake their message. We're trying to supplement and empower their message. And within seconds, they love this idea, our friends in the maternal health field. So I just want to let people know that sometimes 2 is more than the power of the we can alone. Now, and again, this would have to be state law in Georgia. So we just approached a state legislator to propose this. And so it's going through the political process right now. Now, signs work, and this is one of the arguments we have. It might not be as effective as putting a warning label on every single bottle of alcohol that goes out the door. You know, once someone walks into a store, they see the sign once, and then it's gone until they go back in the store. It's not going to be as effective as labels, but it is doable. And what we do see is that warning against the risks of drinking while pregnant is associated with an 11% decrease in the odds that that someone will develop that alcohol. I'm sorry, I got to read this closer. In the odds of alcohol consumption during pregnancy in the 23 states that require posting of signs. So posting of signs is effective. Warning labels about alcohol cancer risk have led to decreased alcohol sales. Again, that goes back to the labels. Greater awareness of alcohol cancer risk is associated with greater support for alcohol control policies. So once we pass a law about labels or signs, it tends to pervade awareness of alcohol's risks overall, and other policies that might be beneficial to keep people safer and more knowledgeable about the risks they are taking are more likely to be adopted in those communities in those states. And reducing the overall level of alcohol consumption, we're not trying to take away a glass of wine from someone, but reducing population level alcohol consumption does coincide with reduced alcohol-related harms overall, the number of people who lose their lives, for example. So, in summary, excessive alcohol use is a larger issue than just alcoholism or DUIs or underage drinking. It's not just an individual problem. It's a pervasive societal issue with significant costs. Alcohol is a group 1 carcinogen and the 3rd leading preventable cause of cancer. And importantly, people need to know that even light and moderate drinking can increase the risk of cancer. Most people don't know this. Consumer awareness, even in our state of Georgia, is remarkably low, under 50%. Point of service signage is a viable, affordable, sustainable, educational, and effective means of raising awareness, which is why Georgia Alcohol Policy Alliance is pursuing this strategy. And it can also lead to and complement other alcohol policies that reduce harms at a population level. So I do want to thank for the groups that have helped me get up to speed with this issue, this very important issue, including the U.S. Alcohol Policy Alliance, and including Thomas Gramignon, who's on the call today. Thank you, Thomas, for being here today. And Dr. Sue Gapster, a consulting epidemiologist with the International Agency for Research on Cancer, who did vet all the statistics that I've shared with you today. And she's also a former senior vice president for behavioral and epidemiology research at the American Cancer Society. These slides will be available if you like them. I do have these citations here on the last two slides. And with that, I'm open to any questions you might have.
Thanks again, Michael. I'm going to actually allow everybody to talk. So if you want to talk, if you just want to ask a question, make a comment, that may be easier than putting it in the Q&A. Just unmute yourself and you can ask a question or make a comment. But one thing I wanted to comment on, because I think we still have some nurses with us, our navigators. One of the one comment or the one statistic you had there about people out in the public, a lot of people out in the public are not aware of the risk of cancer associated with alcohol. And that's something that as nurses or as people working in healthcare, we can do a better job of educating people about risks, cancer risks associated with alcohol and modifiable risk factors like alcohol use and others. So I think that's a real important thing for us to sort of hone in on and understand that yes, we've gotten the word out about tobacco for sure. Because when I talk to patients about reducing their risk of cancer, I usually tell them, I don't have to tell you cigarettes are bad for you. You know that, So we talk about smoking cessation and how difficult it is, but I think continuing to educate people about the risk of cancer associated with alcohol is important, and we have data to support that.
Thanks, Cindy. Great point. Great point.
Yeah, this is Thomas Gramignon, Consumer Federation of America. And I just wanted to say thanks to Michael and to all of you for listening. And I guess to go back on the point about red wine and the health benefits of alcohol, what we've really been stressing in our advocacy is that it's unique to the individual. It's particular to the individual. How the risk and benefits of drinking alcohol shake out. And there's at least one study out there that suggests if you've got one of the BRCA mutations, you're more susceptible to alcohol associated attributable cancer, breast cancer. But for the research on kind of cardiovascular benefits associated with alcohol, it seems to show that those benefits are most likely to occur in people in their 60s with that may have a family of a family history of heart disease and it's particular to each individual, and the research, it looks like it was it's been exaggerated quite a bit in the past, and there are new techniques that have kind of clarified that the cancer risk very much outweighs the health benefits for many people out there, if not the vast majority. And so I appreciate that question and Michael's response.
Oh yeah, I think that's definitely true. And we also have to realize that with the precision medicine initiative out there, these with cancer, especially associated with cancer, we have to look at individual people, ethnic background, many factors, their genomic map of their cancers and all kinds of things. So, definitely ongoing research is important because we continue to learn. And, what we may have thought was right 20 years ago, many times it may not be. So as we learn, I think that's very important. I had a question. Maggie said, thank you. Very nice presentation. Is it available for download? It will be, Maggie. We'll have it. We are recording it. We'll have a link up on Georgia Corps' website for events and past presentations. So,
and the slides too. I'm happy to share those with you, Cindy, if you want to disseminate them to anyone who asks.
Yeah, you just send me an email. If you want the slides, I can send them to you, so that's no problem.
Do I have the ability to type my email? Oh, well, there it is. There's my email address. So if anyone wants to write me directly or call me, I welcome that as well. I also wanted to say on a very personal level, I really didn't put this all together until the last few weeks, but my father is a 2-time cancer survivor. And one of the times was jaw cancer. And he probably smoked a pack a day until he got jaw cancer. And then his bottom jaw was removed, and they took a bone from his calf and reconstructed a lower jaw. So it dramatically changed his life when that happened 11, 12 years ago now. I did not think until this, in the last month, that might have been more or at least as attributable to alcohol as to tobacco. And what's significant about this is that since his surgery 11, 12 years ago, he has not smoked anymore, but he still drinks about 2 drinks a day. And I don't hold any judgment against him for that, but I didn't think that it might exacerbate his likelihood of getting cancer again.
Yeah, I was also thinking when you were talking about the how you would achieve this goal, which I think the point of care sign or point of service, sign is an excellent idea. But it just made me think about, we just had the Super Bowl, and the amount of sponsorship from beer companies. I mean, it's up, it's big.
Yeah.
And I just thought, yeah, but we shouldn't think that it's insurmountable, because, we have made progress with educating people about tobacco, and we have taken on big tobacco. And in my thought, we've actually won some of those battles. So I think it's, even though it's big and there's a lot of sponsorship money out there, I still think for the public, for public health purposes, we still have to educate the public about these things, and it's important to help them be aware of it.
Now, Cindy, I appreciate the fact that you came in and said, well, what about the stories that 1 glass of wine a day can be helpful to one's health? I want to welcome Debbie or Maggie or Pam or Sarah Lynn. If you have any questions, or if you'd anticipate any pushback from people, like, yeah, but what about, I'd love to know what those things are, because if you're thinking them, I know that the legislators I'm going to be talking to are going to be thinking about them too. And I'd love to have people's thoughts in mind when I go to these conversations, and find out if there's a intelligent response to it. So if any of you have any questions or expect any pushback, I'd love to hear your thoughts.
It's a little, I'll just start. It's a little easier for me to counsel people about tobacco use, because I have sort of a standard discussion with them about the fact that tobacco companies make cigarettes and tobacco products the way they do, so that it's not easy to quit. They do it on purpose. They make them this way so that you cannot, or it's very difficult to quit. And because they don't care if you quit, they want your money, because, every pack of cigarettes, they get money. So, I know for myself, it's like, I don't want to come across as just sort of wagging my finger at people. I want to engage the patient and help them to understand, I'm not here, like you say, I'm not here to judge you, I'm just letting you know, this is the reality that, it's hard to quit. It's a drug. It's hard to quit. It takes people an average of 7 attempts to quit and be successful at quitting smoking. I can imagine that people drink alcohol for various reasons. They get done with their day and they're like, I've had a bad day, And so a lot of that is self-medication and things like that. And so, there's a lot of factors where people, and even if you're talking to legislators, I'm sure they have some of these factors where they may do the same behaviors, So I can imagine it's a difficult sort of conversation to have. Let's put it that way.
Yeah, I hear you. I also just want to take a second to acknowledge that my daughter's on the call, and I just love, Sophie, that you took the time to join the call.
Okay, we had a Q&A. So Maggie Fernandez and Sarah Lynn, sorry, I do not have a mic. Yes, unlike smoking, most patients are unaware of link between cancer and alcohol. Exactly. And so we are starting from scratch. I agree. We're starting from scratch when it comes to educating patients.
Yeah, but Maggie, I think you were the one who asked if it's downloadable. Yeah, you were. So it sounds like you're ready to take that message to people, and you might want to have these slides as kind of like to practice that conversation, to know the facts behind it. So thank you
She
for
said,
being.
absolutely. Maggie says, absolutely, exclamation point.
Yeah, that's great.
That is great. That's great. Any other comments or questions you want to post or anything like that? I mean, I really appreciate, Michael, your time in putting this together and, talking about this, because we do need to, start from scratch and make people aware for sure. Definitely.
You're welcome. Thank you. I mean, the opportunity has been great, and I get a chance to try to articulate this story. So I appreciate that.
But I did want to remind people who are attending, who are nurses or just want GNA contact hour credit. When I get done with the presentation and end it for all, then in your browser will pop up the survey to complete. And once you complete the survey, then the certificate for the contact hour will be at the end of the survey. So that's how, and then you just have to save that page. Make sure you save that page. But if you do have any questions, I'm going to put in the chat one more time my email in case you need to copy it. So you can send me a question about that, or a question about when there's a link for the video live. It may take a day or two to get it on there, but I know we will have it on there. So. And, I want to give anybody a last chance to give any, have any comments, questions, anything, post it in the Q&A, unmute yourself and just say it, whatever you wish to do.
And if you want to just write down my email and phone for later, just in case you want to follow up a week from now or whatever, I welcome that as well.
And I hope, Michael, you are able to get this to the bill form.
Thank you.
State. I think that would be awesome, and I certainly would support it myself. So
that means a lot.
What's wrong with having a sign, point of service sign? I think it's great.
That means a lot to hear, Cindy. Thank you.
If nobody has any other questions, we will finish a little bit early, but I think that's okay. But again, if you have any questions, you can email me. You'll see the survey pop up in your browser, and I'm going to go ahead and end for everybody. So Michael, if you have any questions or anything, just get back with me and I'll be glad to respond.
Great. I'm going to email you the final version of this in a few minutes, Cindy.
Okay. All right, well, everybody have a nice weekend, and it's
Thanks,
not
everyone.
raining and it's warm,
Thank
so
you.
have a nice day. All right, thank you. Bye-bye.